Okay, welcome back. And we are really excited to introduce today's guest. As we said, Dr. Marc Siegel is the senior medical correspondent for Fox News. He is the medical director for Doctor Radio on Sirius XM. He's a primary care internist and professor of medicine at NYU Langone in New York City. And as if that wasn't enough, he has a book coming out in November called The Miracles Among Us, which will be published by HarperCollins Fox News Books. Dr. Siegel, welcome to Why Should I Trust You?
Great to be on with you,
Why do you
Brenda.
have
Why
time
should
for
I
us?
trust you?
Yeah.
That's a great title.
Oh, thank you.
We aim to please. Listen, Doc, let's jump right in. You wrote this piece for Stat recently in which you made the argument that President Trump deserves a Nobel Peace Prize for spearheading Operation Warp Speed, which was the government and private industry combined effort that successfully brought an mRNA vaccine for COVID. And you wrote the piece right after Secretary Kennedy announced that he was cutting $500 million in mRNA research. So what were you trying to do here?
It wasn't in response to that. I didn't know that the $500 million cuts were coming. As a matter of fact, we added that to the piece right before we published it. When that was announced, we go, oh, we have a hook. And you know how that works with pieces. Oh, we have a hook. We were planning on publishing that piece anyway. The point behind that piece was that I felt a number of things. I felt that there was a head of steam building up with the idea of, different areas of the world where peace might be happening. And Cambodia said they wanted to recommend Trump for a Nobel Peace Prize. But I'm saying, well, wait a minute. And it's not the first time I've said this, Brenda. I felt that Operation Warp Speed was a signature accomplishment that was unprecedented because it did what Trump actually does best, which is a public-private partnership. That's what he's known for. That's what he did there. That was his piece, which is getting companies together with the government and working out a solution, which was both at the same time. And it wasn't just the mRNA vaccines, which were an incredible accomplishment, and they got mislabeled in a lot of ways. First of all, the technology for mRNA was around since the 1980s. It wasn't some brand new, thing that somebody threw on the country. It was technology that had been well known. What actually happened with the mRNA vaccines, as you probably know, is that Drew Weissman at Penn figured out a way to package the particle so that we could get it into the body without the body rejecting it off the bat. That's called the lipoid nanoparticle. He won the Nobel Prize for that already. So there's already Nobel Peace.
We had him on our show.
He's not alone.
But let me ask you something, Dr. Siegel. Let me ask you something, because I think it's really interesting to hear you say, on one hand, it's like you're talking about this great accomplishment from from President Trump during the first administration to roll out these vaccines. And at the same time, this massive defunding of this effort is happening. I mean, how do you explain that? And particularly, I want you to address your viewers, right, on Fox News, who are, 40% of the population watches Fox News, and a huge percent of them are Republicans. And studies show that many Republicans are very mistrustful of mRNA vaccines. How do you communicate to that group about this technology?
Great question, but you may not be expecting my answer. But let me first finish this first thought. Operation Warp Speed, I got to get on the record here, was about great vaccine technology, putting together different companies who then competed to the finish line. It was about Paxlovid, which is an incredible drug that we still use today. It was about monoclonal antibodies, and it was about rapid testing that we could use for the next pandemic. It was a whole package of assaults on a virus that were incredible and all successful within 9 months. Now, the Fox viewership, I'll tell you how I view that. I'm surprised at something I'm about to tell you, and you may be as well. There's somebody named Heidi Larson in the UK. Maybe you haven't had her on our show yet. I'm going to throw a bunch of names around and they'll all end up on your show. Heidi Larson was the head of the Vaccine Confidence Project for the World Health Organization. And Margie Danchin is the head of the Vaccine Confidence effort at the Murdoch Children's Research Institute and the University of Melbourne, Royal Hospital in Melbourne. Both of them have the same idea about how you communicate about vaccines. And it's not what you might think, because I think they would both say they're on the liberal side of things. They're both liberal-minded people. They're certainly to the left of center. And I thought they were going to use words that I'm used to, like misinformation and disinformation. And that became a code word. I don't say that that's wrong, because I'm also a big believer in Tony Fauci, by the way. So I'm not left or right when it comes to vaccines. I look at them non-politically. But here's what both of these experts said. Dr. Danchin and Heidi Larson both say that the way to approach people about vaccines is not to bludgeon them with what you think the truth is. Even if you're a virologist like Dr. Bartlett there, if you don't bludgeon people with the truth, you ask them where they're coming from. You ask them, what are their concerns? What are their misgivings? What are their worries? And then you try to gently counter it with what you think, assuming they're interested in your knowledge base, which may be why they're in your office. I do something called put a vaccine on the ledge. When I'm talking vaccines, I've already got it there. It's right there. And one of my problems with the mRNA vaccines is I could never get it in my office. And I talked to David Kessler about this multiple times. And I love Dr. Kessler. He's fantastic. But he could never get it in my office either. Not Marc Siegel's office, but the idea was that the mRNA vaccine came in such big sleeves. Eventually, they got it into pediatricians' offices, but general internists like me didn't have it. So people had to go to vaccine centers or pharmacies. So it was a two-stage conversation. Here's why I think you should have it. Here's your concerns. Here's my response. And then they have to make an appointment to get it. They might not make that appointment. So it's a conversation with a person who may have fear. And here's another thing. This, Brenda, you're going to like. I wrote a book on fear, a best-selling book on fear. And I'm very well aware of the fact that when you put a needle in your arm, you're much more afraid of whatever might be in that needle than you are about an abstract virus that you've never seen. Even if, no matter how many times I tell you that the side effects of the virus are far more than the potential side effects of the vaccine, that the side effects of the vaccine may even be along the same lines as the side effects of the virus, only much less so. How come the information that myocarditis was 10 times more likely and is 10 times more likely from COVID than from any vaccine never gets propagated? All we ever hear about is myocarditis and the vaccine. We don't hear about myocarditis and COVID. And COVID vaccines decrease the amount of myocarditis you get from COVID, according to the research.
So, Dr. Siegel, that's really interesting, and you're hitting a really important point, which is Dr. Siegel, the doctor in his office talking to a patient, versus Dr. Siegel, who's on Fox News with the ability to talk to millions of people at the same time, many of whom, like me, are watching something here, they're on Twitter or X, they're reading Substacks, they're listening to podcasts, they're getting all kinds of information. And I think the perception is that the Fox News audience, I don't want to draw massive generalizations here, but generally think that the efforts during COVID, that the government efforts were overreach, that the vaccines posed more harm than were good, and that we can't really trust government on them. And which is why many of them may support, and I'm just going out on a limb here, may support the effort to defund mRNA research. So now I want you to put on the hat as Dr. Siegel, the medical correspondent for Fox News, not Dr. Siegel privately talking to a patient in his office. How do you communicate?
I want to clarify a point, which is I don't think I do this 100% of the time, but I'd say 95% of the time I succeed at saying what I believe on TV without compromising my beliefs. It's hard because I have to keep in mind how receptive an audience is and how they're going to digest whatever information I give them. I think the other hat you're talking about, Brenda, might be this. I think, to be fair, when public health information is delivered by government officials, if it's delivered in too dogmatic a way, it may cause a backlash. And the backlash is definitely not the truth, by the way. I'm not defending that backlash. I mean, I interviewed Dr. Jay Bhattacharya last week, and he's actually saying mRNA technology should still be used for cancer research. I'm glad I got him to say that on TV. I didn't manipulate him. He said that. But he also was in a group which I didn't concur with mostly about, the Barrington Declaration and all this stuff. And I have a different idea about how to control viruses. You don't let people get infected. I mean, the newspaper person could deliver the virus to an elderly person that you're trying to cocoon or protect, So I'm a big believer in in looking at public health from through the periscope of or the telescope of what are your tools? And one of the tools we had was that vaccine. And I was a big proponent of it. I took it on TV. I pushed it throughout the pandemic. But to be fair, since it was an emergency use authorization, and since there came a point when it became clear after the first series of mutations to the virus that it probably didn't prevent spread as much as we thought initially, I think at that point, the idea of mandating use might have been rethought sooner than it was. So I think the idea of government dogma turned off a lot of people, but it doesn't mean that it turned them into the right camp. It doesn't
Yeah.
mean that they're justified in their anti-vax sentiments. I hate that. I also hated it when the ultra left was anti-vax. You know, earlier, RFK Jr. was with a group, you know, that came from the anti-thimerosal movement or the movement related to Andrew Wakefield and his paper that got withdrawn from Lancet. That was on the left. So whether it's the left or the right, the politicization of the second greatest tool in public health history is deeply disturbing. Greatest tool, I hope Maggie agrees, being sanitation. So the greatest
Yes.
public health tool is sanitation. Second greatest is vaccines.
So you mentioned your interview with Dr. Bhattacharya, and you've had an interview with him, you've had an interview with Secretary Kennedy, and and in your stat piece, you talk about how like we're kind of conflating politics and science, and how dangerous that really can be. And it's funny because you said that Dr. Bhattacharya said, look, like we should still invest in mRNA technology for cancer. And, he said in your interview it was a promising technology. It made sense to invest in it back in 2020. And, I think it did a good job in protecting older people. It should never have been used or recommended or mandated for young people. I think like the big shift in all of this is that he says something like the key thing is that public trust in the platform is now gone. And what I'm trying to wrap my head around is because you do seem to be, outspoken about mRNA vaccines in general and their promise, both in respiratory viruses and in cancer. But are we just like prematurely giving up on these? Because yes, we do know that the lack of trust is a real thing, but is that enough? Like, should we be, as physicians, stepping up to acknowledge that lack of trust happened, but that we still should be defending the science of mRNA vaccines? I mean, even in this letter that went out today, it talks about like mRNA vaccines. I'll have to get the exact language, but it says, it's possibly our best line of defense against another respiratory virus pandemic. And we just walked away from that. How do you communicate that given your support?
And this is the letter.
Yeah, this is a letter that Doc, you probably know about that, I think it was like 750 or over 700, CDC, HHS workers sent from CDC, NIH, and HHS sent to Secretary Kennedy after the August 8th shooting and attack on the CDC. And it goes on. I'm sure you've seen it. It goes on. But one of those things it says is this is possibly our best line of defense against another respiratory virus pandemic. How do you acknowledge that lack of trust, but still defend mRNA to your audience?
It's an evolutionary process. You're asking a really important question because just this week, the American Academy of Pediatrics came out with a study that showed that of the thousands of young people who got hospitalized from COVID-19, the vast majority of them were unvaccinated. It's another line of proof of the value of mRNA vaccines in children. That's not an accident because that actually occurred at the same time that Michael Osterholm had the Vaccine Integrity Project this week, which I was one of the interviewers of, including virtually sitting next to. I can't sit next to anybody, but virtually sitting next to the editor-in-chief of the New England Journal of Medicine, a real prestigious honor, because he's an infectious disease specialist. And I was in rarefied air. Rochelle Walensky was involved in that. That was incredible. But the point is, it's kind of an alternate reality, looking at mRNA through the prism of Osterholm, of CIDRAP. And I think that puts me in a better position today to answer your question, which is my sense of mRNA vaccines prior to that conference I just did was that maybe the vaccines have more side effects than I want short term, compared to something like Novavax technology, which was never fully explored and should have been, or Peter Hotez's vaccine, or whatever vaccine you want to talk about. But now I think after that 2 hour conference, that what exactly you just implied is right, that with emerging pandemics and emerging contagions, mRNA may be our best defense. And
But
so
we left it. But we left
we
it.
shouldn't. Well, I mean, I didn't leave it, again, I want to make this point. This is how, in my humble opinion, we should approach things. It's that study of in pediatrics this week, and me listening to people present 1,700 publications that they reviewed yesterday, that reminds me that we probably should not be uh, forgetting how great a line of defense this is for emerging contagions. Once you have an established contagion, maybe you develop, newer technologies. I don't know if I don't know if mRNA vaccines are the long-term solution to all of our ills, but I agree with where you're going with this, that they should be there for pandemic preparedness. There's no question about that. But I'm not the one making that decision. And I was reminded of that this week listening to that panel.
Yeah. I mean, he also said in your interview that, look, we're going to go into new platforms and new directions. And, this whole virus inactivated vaccine, relying on an old idea, but, going back, and Maggie can tell us a little bit more about what that means exactly. But with what you know about mRNA, are you comfortable with that journey towards, these whole virus inactivated vaccines?
I'm glad you said two different things. Let me answer both. The person I interviewed about whole virus inactivated vaccines is Jeff Taubenberger, who is the acting director of the National Institute of Allergy and Infectious Diseases, Tony's old position.
Yeah.
I have always found him to be very convincing, and he believes in this technology. He's the guy who went into the tundra and found the Spanish flu. I am a big fan of Taubenberger, as was Fauci. So the fact that he's behind this, and I'm not a virologist, makes me take it seriously. But the other part that you asked is, I think there's other emerging technologies involving CRISPR, involving plasmids, involving different antigen vaccines. There may be a future and Maggie knows this much better than me, but Dr. Iwasaki at Yale has done a lot of research on not on whole virus vaccines, but on barrier vaccines, looking at mucosal vaccines. Now, those are not getting a lot of funding right now. But the point is, there may be a future in vaccine technology where the whole apple cart isn't mRNA, but it's part of the armamentarium, and we should have it.
I think this is really interesting, and I picked up on a few things that you said, but I want to get your perspective because I'm really concerned about our innovation being stifled in this era, especially with the cuts to mRNA vaccine approaches. And I think that we have to rebuild trust, but we also want to make sure that American biotechs are making new innovations, that researchers at our amazing research institutions are able to bring on grad students to do this work that one day might lead to a Nobel, but we don't know. CRISPR was, studying basic things about bacteria. Learning what Drew Weissman did about mRNA was because he was looking at fundamental differences about those molecules. And I think that for the mRNA platform, like you said, we had been studying it since the 80s. It had made several platform approaches in the 2000s and was ready when we needed it during the pandemic. But now we're kind of taking a step back. And I think whole live vaccines have been a staple for a long time. But I feel like in some way we're setting ourselves back in time instead of forward. I think antigen design is really important. And I think Jeff would agree. And that's one of the things he's been working on for a universal flu vaccine. But I wonder if you might just talk a little bit about how you see this politicization of science impacting innovation in science, especially in America, and what that means for us long term.
I'm concerned about it too. By the way, I'm glad I passed muster with you, Dr. Bartlett, because I saw you smiling while I was talking. I've talked to a lot of great virologists, so I'm concerned about it. But I like something that our outgoing dean at NYU said to me, Dr. Grossman. He said that There probably do need to be cuts, but they should be done with a scalpel, not an axe or a hatchet. And one of the places that they might have considered cutting were those grants that are internal, where somebody is giving it to somebody who's their friend or something like that. When an external institution like Harvard or NYU, or when a big medical center is applying for a grant, they got to go through so many things to get that grant. I'd rather not see those cuts. So I kind of agree with my boss here, who's a mentor of mine. Maybe there's bloat, but it doesn't. It looks like they're going to end up stifling innovation, which is deeply disturbing. That's something that should be addressed. Now, I don't know whether that comes from Doge or whether that I don't know where that exactly comes from, but I'm concerned about it too. There are things to be cut, but we shouldn't be cutting our juggler here.
Yeah. Dr. Siegel, I want to talk a little bit about MAHA and Secretary Kennedy, the Make America Healthy Again movement. It's a movement that, in our experience, we bring a lot of folks on from the MAHA movement. We have conversations with them. We moderate conversations between them and folks from public health. They're really interesting. What is your kind of take on what they're doing right now, if they're putting the issue of chronic disease front and center in a way that you think is really working? Is it giving you hope? And then how are you communicating with your audience about MAHA and Secretary Kennedy?
I actually take this very positively. The naysayers say, look, they're not going to get anywhere because of the lobbyists, and the lobbyists are not going anywhere, and the lobbyists fight back all the time. But Kennedy comes from this place as an environmental lawyer, and I'm much more in tune with his concerns about poisons in the environment, about everywhere chemicals, about microplastics, about the fact of I do agree with him about ultra processed foods. I'm not a believer in the carnivore diet. That's already gotten me attacked on social media because I think I'm a believer in the Mediterranean diet and antioxidants, and fiber. But exercise is something we have to bring back, and I think we're causing a generation of obese, sedentary individuals. So and again, some of what he's doing, Michelle Obama was doing. So I don't know that it's all new, and I don't know how much of it is going to work. But I like that some of the states are ponying up and trying to get. I wrote another piece in Stat about that ultra processed foods are addictive. That this whole thing is an issue of addiction. But of course, when you're addicted to something, you got to find something to replace it with. So simply banning candy and Coke isn't going to be the answer. What are you actually getting into school lunches? What are you getting into SNAP? What are you going to replace this with, and who is going to pay for it? But and that's a big what if because it's got to be part of the solution. I'm a big believer in getting more to farm to table and away from food that I like to say doesn't know where it came from. Food that was made somewhere in a laboratory, it doesn't even know where it came from. We're having a society of kids. And by the way, one more point. I just interviewed one of the head endocrinologists at UCSF who said that the key problem is sugar. We can call it whatever we want to call it, but the big problem with ultra processed food is sugar, and that's of course addictive.
We've done a lot of episodes on ultra processed food. Even our last one was about the citizens' petition to kind of rethink how we talk about generally recognized as safe, which a lot of ultra processed foods are generally recognized as safe, and there's a lot in that arena. But I want to go back to something that you had mentioned briefly, the American Academy of Pediatrics. They are back in the news, as you know, today, because they are, for the first time, really breaking away from the CDC, especially as it relates to the immunization schedule. So they publish what they're calling an independent evidence-based immunization schedule for children and adolescents. This is on the heels of changes to the vaccine approval process, the ACIP committee. I want you to put your reporter hat here instead of just your doctor hat, because, obviously I think this is something that you're going to have to talk about on the air and talk about as you advise viewers and, family members, parents. How do you now communicate this in a way, in a world where we don't trust the CDC? People still do trust their doctors for the most part, but now you have doctors and this official body that's supposed to be the guideline, Bible, differing. What do we do with that?
By the way, in answering your question, Mark, I want to refer to something that Brenda was bringing up before, whether she knows was bringing it up or not, because you talk about the different hats I wear. When I'm wearing my reporter hat, I'm out there to figure out what the person is trying to say, not what I'm trying to say. So you might say, well, how do I ask Dr. Bhattacharya this thing when I maybe think something differently? Well, I'm there as a reporter. I interviewed President Trump in the White House in 2020. He said he was going to take a vaccine with me on the air at that time. But that's not what got publicized from that interview. It was person, woman, man, camera, TV. I mean, I'm not in charge of what gets publicized, but I am in charge of what questions I ask, just not what answers people give. When I come as a commentator, like I am now, you're going to hear my opinions. Okay. And when I'm as a doctor, that feeds both. So I continue to see patients for this very reason. I don't want to be a talking head. It's probably why Sanjay still operates in Emory, although he doesn't do it that much. But I'm very friendly with Dr. Gupta. We're good friends, and I respect him greatly, and he respects me. We don't look at it politically. The answer to the question is that is what I was referring to before. That the study that was put out in pediatrics. Then the Vaccine Integrity Project that I just participated in probably led to what you're talking about, which is a statement that's different from ACIP. And it came up yesterday at the Osterholm panel that ACIP's statement is at odds with the studies. And so the American Academy of Pediatrics is coming out one place. ACIP, which, as you know, has been modified, shrunk, gutted, or whatever word you want to use, is coming out somewhere else. What I'm interested in, and I'm finally going to answer your question now, is what's good for children. And I'm concerned about if I want a child to have a vaccine, is insurance going to cover it or not? And I'm convinced that these vaccines should be covered if a child needs to have one. It doesn't mean every child should take a COVID vaccine. It means that I want the vaccine to be available. One of the things that study showed in pediatrics was that children with more comorbidities, I'm looking to see if Dr. Bartlett nods again. If people with children with more comorbidities are more likely to be hospitalized from COVID and are less likely to be hospitalized if they took the vaccine. The key being comorbidities. I want that vaccine to be available. If I were a pediatrician, decided to give it to every child or not, isn't the point. It's availability.
Yeah, I would just underscore, vaccines are only as good as if they make it into the arm, right? So if they ever are just sitting there, they don't get to stimulate the immune response and everything like that. And you talked about earlier the experience of not having that vaccine to reach out for, even though people were asking for it or you were advising for it. So I think it's an interesting nuance to get at, especially as we're facing, who do we trust? Who will you tell your audience to listen to follow guidance when there's this rift happening?
Well, and you're teasing to something else that I want to get to that you're going to smile again, I think, which is the whole issue of herd immunity, which was misdescribed during the pandemic. Vaccines have two purposes. One is to protect the individual. The other is to protect the community. And one of the reasons the main reason we give the MMR vaccine is to protect the community because it's such a wildly contagious virus. And you have to get at least 95%, as you know, of the country vaccinated to protect the 5% that can't have it. That should be crystal clear, and the anti-vaxxers should stay completely away from that, but they don't, unfortunately. On top of that, I believe that there's a community value to a flu vaccine. You're protecting the individual, but the number of hospitalizations is going to be lower the more people take the flu shot. So that point, I think I wasn't emphasizing enough, that there's a community value to vaccines in addition to an individual value.
I'm fascinated by your point in the very beginning when you said, and I have to struggle with this sometimes too, as a physician and as a reporter, and I think people really turn to people like us and like you for guidance. And you said that, 95% of the time you're able to do your job. What exactly did you say? Can you say it again?
I try to put forth information that I can live by and I believe in, but look, today they ask me to talk about cesium 137 rather than the pediatrics announcement. So like I don't choose the topics or even the shows I go on, but I choose what I think is the truth about it. So like I'm out there saying I don't take creatine. I'm out there yesterday talking about how I believe that the COVID vaccine is valuable. It depends on who's asking me and what the topic is. But I try not to ever compromise what I believe the truth to be. And one of the ways, by the way, to do that is to interview people who are even more expert than I am on something. So I try to accumulate a body of information that I believe in. And here's my point to you before, Mark. I try to make that evolve over time. I'm telling you something that's a little bit unusual, that I'm even more convinced of the value of the mRNA vaccines this week than I was last week, because this week I just sat on a panel for 2 hours where experts who had been studying 1,700 papers presented to me.
Yeah. We're in an age now where we're teaching people and asking people to be discerning consumers of health and information and, question policy and do your own research and look at the science. How do you that is great, right? It is great to have that curiosity. How do you stop doubt or questioning from becoming or transitioning into distrust? How do you teach your patients or your audience that just because you ask questions, it's not the logical path always to go down to mistrust?
I think we're at a really bad time in terms of accepting other people's beliefs. Okay, a person's politically motivated and they're being misled by unscientific info, and I can't do anything to stop that, or I'm doing whatever I can to stop that. Nobody owns the truth. And so I think we've become an intolerant society, and I think that's something we should walk back from. I don't know what would cure the disease. The disease is intolerance, self-justification, my way or the highway, rigidity, anger, hatred. I mean, we need to walk that back. I gave a clue how I was taught to do that when it comes to vaccines. I want to say that again. I couldn't believe the way Heidi Larson talked about this. I was all armed with terms like misinformation. And she said, don't use that term with me. I don't believe in that term. I don't use that term. I go, really? That's the only term I'm hearing. She said, I don't think that term helps. That implies you know and somebody else doesn't know. Why don't you listen to what they're saying and then counter it with what you think may be different? I like that idea. On the other hand, I feel that really serious scientists, I'll show you the other side of this, Mark, really serious scientists are guarding their careers. They spent decades learning to be great scientists. They don't want to be up against some talk show host that's making it up out of their hat. Scientists are deeply disturbed if the public is listening to somebody uninformed. I said throughout the pandemic, why are you bringing your Ferrari to a bicycle shop? Bring it to a Ferrari dealer. And who would the Ferrari dealer be? It would be Dr. Bartlett, or it would be Eric Topol, or it would be Tony Fauci, or it would be Osterholm. It would be I love Topol because Topol is like sitting there studying this stuff. He's underlining all day long. I don't know if he can even see anymore. He underlines everything.
Oh, those were great.
Eric is great, but Eric is an old style scientist who believes that things have to be carefully looked at. Primary sources, not preprints, primary sources. At that panel I was on this week, the Vaccine Integrity Project, they would not present a preprint. They said this hasn't been peer reviewed. Remember during the pandemic when that was all we ever heard was preprints?
Yeah. Yep.
Let me ask you about that, Dr. Siegel, because what you're saying is, a Ferrari, whatever, was it a Ferrari driver going up against a Ferrari dealer? I'd say that what often happens, say it's someone like you interviewing somebody like Secretary Kennedy, right? He's in charge of the Health and Human Services. I remember during when things were really bad in West Texas during the measles outbreak, that interview you did with him, you know, if he says something about vitamin A, or if he says something about, say, the measles vaccine causing death, which my understanding is that is not an accurate statement, that the measles vaccine causes lots of death every year. How do you deal with that in the moment? And I'm saying this as somebody who knows that many of our listeners really trust Bobby Kennedy, that he does hear them, and he is kind of banging the drum on a certain way of looking at health in our country that is resonating with people. But when it comes to those cold, hard facts, what do you do in that moment?
Again, you're not going to believe this answer. Okay. You ready for an answer you're not expecting?
Do it.
Okay. When I first met George W. Bush to go mountain biking with him and the wounded vets, I expected to meet a really dumb person because that's what the media described him at for years. I found him to be incredibly smart. He's the guy who got an MBA from Harvard, not the guy who got a C from Yale because he was goofing off. He is really smart and he has a high EQ. He sees all places, you know, like, and over the years, I feel that more and more. And he never wanted to talk about himself. He didn't talk about PEPFAR, the President Emergency Plan for AIDS Relief that has saved 25 million lives. He doesn't take credit for that. He approved it and he's very proud of it, but he's humble. He didn't take credit for that. Obviously, the Iraq War, he takes credit for. I'm not talking about that here today. I was not a believer in it. But Bush is a guy who has personally, on a personal level, on a one-on-one level, is very impressive. I then became aware that maybe the person I'm meeting isn't the person I've been reading about in the news. When I interviewed Bobby Kennedy, I had been on his radio show years before, Ring of Fire, several times, and he was a great interviewer. I never agreed with him on the vaccine question, and I once publicly debated David Kirby, who wrote a book with him about, I debated him publicly about thimerosal and autism. And this was like in 2013. Since then, we have found that there's signs of autism in the womb. So it can't be the vaccines anyway. Even if you thought it was, it can't be because the signs of autism generally occur earlier than birth even. Kirby said to me, you know, you're right in this debate. I said, yeah, but how? He said, good thing we looked into it at least. I said, well, how many billions of dollars were spent that could have been looking for other causes of autism? So I have come from a totally different perspective on the vaccine question. But when I met Kennedy, I was impressed by him. I found him to be very intelligent. I thought he answered questions directly. When the interview first showed, the first part of it, on one of our early news shows, something occurred technically where it didn't come across right. And then we fixed it. So throughout the day, it was on Special Report, it was on all these other shows. And I believe that most of what he said came across correctly. And then the whole interview aired on Fox Nation. But what you just said is kind of what, and by the way, I'm not against the New York Times or the Washington Post. In fact, I have many of the reporters from there on my radio show all the time. I'm friends with them. I have good relationships with Dan Diamond, with the political science reporters, with the health policy people, with people that attack Kennedy, with all of these people. But I feel like the initial reaction to that interview wasn't fair. Because here's what Kennedy actually said about vitamin A and about vaccines. First, he said in that interview that he believes everybody down there should get a vaccine. And that was something I hadn't heard him say before. He added, it's a matter of personal choice. When Dr. Bartlett's going to agree with me, it's not a matter of personal choice. That vaccine can't be a matter of personal choice, or we're going to get measles. Because measles is so, you can't have both with that vaccine. And you might say to me, why did I let that second comment go? And that's maybe the 5% I was telling Mark before. I was so impressed with the first comment, I wanted to get that out there, that Kennedy is saying, I want everybody in Texas vaccinated. The second part of it with the vitamin A, you're not going to believe my answer to that. I talked to the World Health Organization about that after the interview, Dr. Tedros and Dr. Ryan, who is still with WHO, and Maria von Kerkhove, and they all agree. Maria von Kerkhove, I interviewed on Fox. They all agree that malnutrition is a big determinant of outcome in measles. That's what Kennedy said. And WHO agrees with him. And they agree that worldwide vitamin A deficiency is related to that. That's what Kennedy said. He said that there's a group of doctors in West Texas giving this cocktail of cod liver oil, and they seem to be having a positive outcome with it, and he wants to see it further studied. That's what Kennedy said. That's not what the New York Times reported he said, but that's what he said. Unfortunately, though, you might say, come on, cod liver oil, vitamin A. I mean, crazy stuff.
I might interject and just say, Diane Griffin, who I studied with at Hopkins, studied vitamin A on measles, and it is known that it's helpful if you're malnourished, but that's not typically the case here in the US. And I wonder, from your perspective, it came across to me that doing these anecdotal studies in an active outbreak were doing harm instead of do no harm when we had a viable solution. So how...
Because I have one more answer to that. That was a great comment. Great comment, Dr. Bartlett. Listen, there's one other thing he said. He said, and remember, I'm there with my reporter hat. He said that he's talking to community leaders in West Texas, and he's positive that population is malnourished. That's not what subsequent investigations have shown, but that's what Kennedy said. And I didn't feel like contradicting him at that moment because I didn't know if that was true or not. I'm not down there in West Texas. He says he's talking to community. But your other point is right. You're making a really powerful point here that I want to agree with. All of the intent, and Brenda will agree with this too, all of the focus on malnutrition could take the emphasis away from what you really need, which is everybody to get that vaccine, which is why that's all I kept saying on the air over and over after that. So my goal as a reporter was to bring out what he had to say. It was taken out of context unfairly by other media outlets, but then afterwards, I kind of thought what you thought, so I kept pounding on the vaccine, which is truly the only thing you can do. You can only do that vaccine.
Yeah, I remember watching that interview, and I remember, kind of looking to you for those signals, and the way you just explained it today, I think has, in a way, changed my perception of that interview, because at the time the stakes were so high, and it was, having a physician there at the table with him. It was almost like the delivery, and it was just nutrition isn't the issue here. And, vaccines are, but the way, that commentary that you provided just now, I think is extremely valuable and helpful to hear it at this point.
Dr. Siegel, I want to ask you one final question, which is, in this moment where so many folks in public health and science are feeling, angry, they're feeling under attack. The other thing I pick up a lot on is they're feeling powerless. Their jobs have been cut from the medical research infrastructure. And I'm seeing a lot of them fight back. I'm seeing a lot of them say things where they really want this administration to know that tools have been taken away from them. But what advice do you want to give folks who are doctors, researchers, public health workers, maybe that could help refine what they're doing right now and make it even more productive, make it even sharper?
I want people to stick to their guns. I stuck to my guns during the pandemic, and I was under a lot of attack from the left when I actually come from the left. I used to write for The Nation. I mean, I wrote a column for the LA Times for years. I wrote for the Washington Post and the New York Times. I come from the left. I consider myself a centrist, and I try to be as non-political as possible. But people who, when they had more power, were saying things like DEI, well, let's consider that diversity everybody believes in, and inclusivity everyone believes in. So if you were talking about DEI before, don't be afraid to talk about it now. I talked about a lot of stuff during the pandemic that drew fire. I didn't love it, but I felt comfortable in staying within my system of beliefs. But again, add to that I'd rather hear what other people have to say. I'd rather be a reporter. So I'm a little disappointed in people that are afraid now. I think great scientists should speak out and stick to what they believe in, and it will come around their way eventually. It has to. we can't head into a dark ages where we're all drinking grog or whatever they did in the Middle Ages. We're going to have no electricity. I mean, we have to look forward and stick to what brought us here, which is great science.
Well, I just want to thank you so much, Dr. Marc Siegel from Fox News, for joining us. You know, we're also in this business of bringing people on who, you know, all of us may not always see eye to eye, but we try to engage in really healthy, spirited conversation, because that's part of, I think, what is getting lost right now. And I think I hope you see what an enormous opportunity and enormous responsibility you also have in reaching such a massive audience, and particularly an audience that may really support President Trump and may really even support what Secretary Kennedy is doing. And I think there's a lot of folks I know in the science world who are rooting for you in that role. So I just want to thank you for joining us on Why Should I Trust You?
You're doing a great job on this, by the way, and it's an honor to be on with you guys. And all great questions.
Yes.
Thank you.
Thank you so much for coming on. Did you have fun?
Yes. Oh, there go the lights.
In the dark.
I
And
love
then you're
this
done.
like
Lights out.
disco. For those who are listening and not watching, Dr. Siegel is in like a motion detector room, so his lights go on and off. So it's like he's like at a club, like in Berlin or something. It's very cool. Okay, so I am Brenda Adhikari. She is Maggie Bartlett. He is Dr. Mark. Tom will be back with us next week. And please send us questions and comments to questions@whyshoulditrustyou.net. That was Dr. Marc Siegel, and we will see you right back here next week.